HealthWatch has taken a unique approach to proactive care and follow-up, one based on proven technology, but taking that technology to a new level. Thank you in advance for your time and thoughtful consideration in the Health 2.0 Challenge, the Discharge follow-up appointment. Before I explain what our solution is, please allow me to briefly explain why we took the approach we did. HealthWatch is a critical components technology and located just north of Boston, home to some of the world's leading healthcare organizations, pioneering new healthcare models of chronic care management, care transitions, and patient-centered medical homes. A lot of funding, talent, and staff resources go into these initiatives, but some may not scale to broad adoption, let alone lasting change. Because while the strategic plan may be great, it's the implementation, performance, and efficiency that will sustain its effectiveness and broad use. Preventive care means changing from a reactive healthcare system to a proactive one, and this remains the major challenge. Care transitions require proactive follow-up and chronic disease management to be truly successful. The problem is there's just not enough doctors, nurses, and care coaches. And if there was, the mantra better health, better care would come at the expense of greatly increased costs. Telehealth is another example of good technology that improves care, but is largely too costly and complex to reach more than very few high-risk individuals. The healthcare community needs to develop new care delivery models that improve the quality of care and employ new technology at a time when there's pressure to control costs. The technology also needs to be vendor agnostic, meaning it'll fit into any existing program and augment that program seamlessly. It has to be easy to use and implement and add value to the healthcare supply chain. HealthWatch is exactly that tool and lasting approach. It'll never be obsolete. We support comprehensive, coordinated, and patient-centered care while lowering costs. Scheduled communication is critical to long-term care and follow-up, and this is the weak link. So with an eye on what would support care for one individual and scale to fit a program with thousands, improving both performance and efficiency, we've taken IVR, or interactive voice response, to a whole new level. Okay, here's how it works. Keep in mind we designed this to be simple, non-intrusive, yet highly effective. The technology is all behind the curtain, so neither the patient nor the provider ever really see it. So this explanation is quick. A patient is given their care plan and follow-up schedule. This plan is used to develop the most appropriate call script, including any reinforcement, prompts, appointments, or questions that may require one to take measurements like weight, blood sugar, blood pressure, anything, in any language as well. The patient can expect these calls at a time they said was most convenient and respond accordingly. Once set up, these calls continue to engage the patient and the provider and structure that continuous or ongoing care. The calls regularly reach the patient when they're more receptive, so they better inform and reinforce and support that care plan. Responses and any collected data is immediately populated into reports and then sent securely to authorized caregivers. Note the plurality as we move into medical homes and ACOs, and include the family as well. The caregivers receive patient responses almost immediately on any connected device. So these calls not only help the caregiver provide more regular and timely care, they encourage self-care and compliance and do it in a very non-intrusive way. Some studies have actually shown that patients prefer this type of call over live people or strangers calling because they know what to expect, when to expect it, and there's a sense of anonymity to these calls. In short, There is no more efficient solution which is as effective in engaging a patient's self-care, involving them in their care, while improving the efficiency and productivity of those that care for them. From Bonn HealthWatch, thank you for this opportunity.